probably know someone with migraine, but did you know that more than 38 million people in the United States suffer from it, and more than 1 billion people worldwide? Migraine is one of the major causes of disability. According to the Migraine Research Foundation, 4 million people suffer from chronic daily migraine. This results in an inability to work, and often causes them to apply for disability, and they lose their job or career. Other people only suffer from migraine once or twice a month, but anyone who suffers will tell you that they just can't work during the throes of a migraine. So why can't they take medicine and feel better? The answer may surprise you. Most people just can't get a handle on a migraine, no matter what kind of medicine they're given. Side effects from medication are often dangerous, and most people don't want to take it. They'd rather suffer the migraine than suffer the side effects. Migraine medicine is a hit or miss treatment. Most people have taken 5 or more medications before they find something that somewhat works, and then they still suffer from migraines. A preventative medication is like a Band-Aid. The real problem is actually bigger than just the migraine. The medication that's used to stop migraines often causes rebound headaches, and then the migraine cycle continues. So what's the answer to the worldwide suffering? How do we escape the migraine epidemic? Believe it or not, probiotics are the answer. We shouldn't be looking to the pharmaceutical industry to cure migraines, and that's because migraines are caused by an imbalance of gut flora. There is no medication to correct the imbalance of gut flora in the pharmaceutical industry. So what does my gut have to do with my brain? The gut is connected to the brain, and scientists call the gut the second brain. In a recent report in Frontiers in Neurology, scientists have found that possible underlying mechanisms of migraine and GI diseases could be increased gut permeability and inflammation. Scientists believe that it's worthwhile to investigate probiotic use in people with migraines. And scientists have found that the major environmental factor in people with migraines is the lack of good bacteria in the gut. And giving probiotics to these people adds beneficial bacteria back to the gut. So how does that help with migraines? The brain and gastrointestinal tract strongly are connected through 3 different pathways: the neural, endocrine, and immune pathways. The communication between these actually works both ways. The brain communicates with the gut, and the gut communicates with the brain. This proves that the gut's imbalance of bacteria actually does cause migraine and other neurological diseases. One study shows that headaches are more common in people with GI problems. The leaky gut causes inflammation, and then inflammation can show up anywhere in the body. It doesn't have to be just in the stomach. And this is what happens with migraine. Inflammation from the leaky gut occurs along the trigeminal nerve. The probiotics help maintain and improve the gut barrier function. And this results in less gastrointestinal problems and less migraines, and that is due to less inflammation in the body. How do you correct this problem? You correct it by getting to the root. The medications are just causing more side effects and acting as a Band-Aid. And the probiotics are getting to the root. So if you know anyone suffering with migraines, I urge you, tell them about probiotics. Tell them about the link between the gut and the migraines. Tell them to try a high-quality probiotic for a few months and see how they feel. You can help people with your newfound knowledge. The research is there and scientists prove it. Doctors just don't tell their patients. The best thing you can do for your families and friends who suffer is tell them what you know. They'll soon also know that medicine is not the answer.